Good morning, everybody. Welcome to Health Talk with Dr. Mutiat. My name is Dr. Mutiat OG, Dr. Mutiat Sunshine, whatever you like to call me. I am a board certified nurse practitioner with damn near 20 years of experience. Welcome, welcome, welcome. Happy Sunday. I hope you guys went to church. You spent time with family, and now you're taking time to listen to me. I appreciate you for that. Thank you so much. Thank you for being here and not letting me talk into free air. I appreciate you. I'm just going to give people like 5 more seconds before I get started. And before I get started, please understand that this is my little spiel of this is not the end all be all. This is not supposed to be a substitute for care from your providers. This is for educational, informational purposes only. I hope you gain something, learn something from this, and apply it to your life. But also, before you do anything I say here, please see your own primary care doctor, see your own provider, and discuss with them before you do anything, make any changes or make anything like that. I am not responsible. I am not liable for, if you take my words at it and just go do and apply without speaking to your doctor. Please, 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 let's all be careful. All right. So today we are going to be talking about osteoporosis. Let me quickly. All right. Okay. Say hi to me, whoever's here. Don't make me feel lonely. Say hi to me. I want to know who's here so we can talk to each other. Make sure I'm not talking to free air. Okay. Who's here? All right. So let us get started. All right. I know I've talked about several silent diseases. We've talked about hypertension. We've talked about diabetes. Another silent disease that we are going to talk about today is called osteoporosis. This is a silent disease that kind of like eats your bones, for lack of a better word, eats your bones and doesn't replace it back. All right. It is a silent disease because you don't know. The reason we call it silent is because you don't know it's happening until it's happened. Again, which is why you need to visit your doctor yearly for your preventative checks to make sure all things are going well. Because there's some things that are going on in your body that have no symptoms, that have no signs until something has actually happened. This is one of them. Osteoporosis is one of them. All right. So prevention is key because once your bones deteriorate, once your bones are gone, there's no bones anywhere for anything. In fact, any part of your body that's gone, there's no spare. We don't have spare parts. We don't have spare parts for bodies. So this is why you need to be extremely careful about your body. All right, let's keep going. Okay, so let's define osteoporosis. All right, osteoporosis is when your bones become weak and so soft and so brittle that they break easily. All right, this is like any small thing can break your bones, like coughing, walking, bending over to pick up something from the floor, something like that. Something like that will break your bones. So which is why again, careful. I know I'll keep saying it because people don't listen. Everybody doesn't listen. That you need to make sure you visit your doctors yearly. If I ask now, how many of you have seen your doctor this year or made an appointment, or when was the last time you had preventive care? Nobody will tell me because we all go for episodic care. When you're sick is when you go see your doctor. But I hate to break it to you that there's some times that when you're sick, there's no reprieve, there's no treatment. It depends on what it is. So please prevent. All right, let's keep going. Now, bones are living tissues. Bones are living things in your body. Just like every part of your body is, that it will die, it will reform, it will die, it will reform. But what happens in osteoporosis is like it will die, but it won't reform. Like it will not go back to like it's dying. I mean, it's dying faster than it's being replaced. So what is there is just soft, just enough to hold you. So any small thing will break your bones. All right. All right. Hi, Miss Julia. Thank you for joining. Thank you so much, everybody. I want to say hi to me, people that are here. Let me know that I'm not talking to myself because it kind of feels lonely and I kind of feel terrible talking to myself and nobody joining me. So I don't like it. So please say hi to me. All right. Okay. So we keep going. All right. So everybody, both males and females, can be affected by osteoporosis. Both men and women can be affected by osteoporosis. All right. So remember, like 2 Sundays ago, we talked about menopause, and I talked about women lifting weight because the hormones that are protective to your bones, your heart, they're no longer there, and it can result to osteoporosis. Men also, as much as they think they are immune and all that, men also they suffer decrease in hormones, and the hormones that can also help them with this decreases as they age. I know men only think women are the only one that go through menopause. They go to andropause also. So yes, all right. Thank you, Miss Moji, Mr. Daniel. Thank you. Hey, and Miss Odwanyo. Thank you for joining. I appreciate you. All right. So there's so many things that can affect your bone health, and which is what we're going to talk about today. All right. Now, what do you think, if I'm going to ask you now, what do you think is the most common fracture site that we have? What do you think, which bone, all right, is what can you break the most if you have osteoporosis? What is the most common fracture site in osteoporosis? What bone do you think we can break the most? I'm looking up for your answers. Give me answers, all right? I want to know what you think, all right? I want to know what you think. What bones or bone do you think we break often when you suffer from osteoporosis? Is everybody there? Is anybody here? Am I talking to myself? Am I talking to myself? No answer? No answer? Okay. All right. We can break our wrists. You can break your backbone, your spine. You can break your hips. Yes, all those can happen. Your knee, okay, all right. But the most place that I didn't get when you said, why women go through andropause, like men, their hormone, it's called androgens. So andropause, they go through andropause. All right. So the way you break the most is your spine and your back. Your back and your hips. I apologize. Your back and your hips. That's the part of the bone. That's the bones that break easily with osteoporosis. That's why you see elderly people, we try not to make them fall. We're trying to make sure that they don't fall, because if they fall, it's sometimes difficult for you. They break a bone. It's easy for them to break a bone. And from there, other complications might arise. So that's why you see we're very careful with the elderly. Please don't fall. So because of that. All right. As we go on. All right. What are the symptoms of osteoporosis? Back pain, as evidenced by collapsed bones. Like I suffer from back pain. I chronic back pain because of the kind of job I did, and my back always hurts. I have a wrist pain that's from arthritis, and I have knee pain. I don't have osteoporosis yet, but I have arthritis, which is another topic that we'll talk about later on. I'll discuss that after this one. Osteoarthritis, we'll talk about that. All right. Loss of height, back, hips, and shoulder. Your hips, yes. Your back, yes. Those are definitely the ones you break easily. All right. You will see someone stooping over when you see like an elderly adult, like bent over, like they've lost a lot of bone mass. All right. And when bones are breaking easily. Now, I want to clarify that children do have some diseases that break their bones easy. I think it's osteomalacia or something like that. I'm not a peds person, but there are like some genetic diseases that also with kids break their bone easy. They may not have osteoporosis. They may have that genetic disease. But adults, elderly adults over age 50, it's very, very common. It may happen under 50, but over age 50, we tend to see a lot of osteoporosis. All right. Okay, let's keep going. Now, causes. All right. Like I explained earlier. All right. The bones are always moving. They're always like they're breaking down, coming back, breaking down, coming back. And then what happens, osteoporosis is like the rate of it's breaking down faster than it's coming back up. So what is there is just mush, for lack of a better word. It's not as strong as it can be. And in our age, I think age 20 to age 30 is when you have the best bones ever. Your bones are the strongest when you're between age 20 and 30. After that, unfortunately, life, wear and tear, everything starts to decrease little by little. So as people age, the bone mass is lost faster than it's created, like I explained. Okay. So you are likely to develop osteoporosis depending on how much bone you had when you were younger, how much bone structure, how much you did. Like if it was sedentary, if you're skinny, these are the things that does not make you have that much bone strength. All right. So you, as you're younger, if you're listening to me in your 20s, if you know someone in their 20s and 30s, this is when they start doing bone sparring exercises to keep their bones strong. So when they cross over into their 40s and 50s, their bones remain strong. All right. What are the risk factors of developing osteoporosis? Number one, being a woman. Being a woman. Women actually, unfortunately, have osteoporosis more than men. All right. They have osteoporosis more than men. If you're biracial, like if you have a Caucasian mixed in you, good chance you may develop it. But if you're black, yes, black people do. Africans, we still do have osteoporosis, but it's not as high as our Asian counterparts. It's not as high as our Caucasian counterparts. Okay. All right. If you have a family history of osteoporosis, good chance you may have it, which brings me to please know your family history. Know what's happening to the people in front of you. Your father, your mother, your biological aunts, your biological uncles, your grandparents. Look at their medical history. Some of them may be genetically passed to you. So family history is very, very important. Not everything is Ojuaye. Not everything is village people. Look at what's happening to them and note that mentally, because unfortunately, some of that genetics may be passed on to you and will be passed on to your children. So keep medical histories. Okay. All right. Like I said, frame side, if you're on the skinnier side, you may develop osteoporosis in the future. All right. Because you have less bone mass to draw from when you get older. So if you're skinny, people automatically think skinny means healthy. No, you have your own other issues. Like you didn't develop a strong bone. So you need to exercise. Exercise when you're skinny does not mean to lose weight. When people exercise, it's not for losing weight. It's to maintain strong bones. Remember, I told you 2 Sundays ago that I lift weights. I lift weights so my bones will be strong. I can have strong bones because I am in my 40s. I know I look fat. I look gorgeous. I look all that, but I am in my 40s. So I need to maintain my bone strength. Okay. So like I explained earlier, some hormones, all right, lack of hormones like your estrogen, like especially for women, when you reach menopause and your estrogen drops. Remember, I told you estrogen is a hormone that protects your bone. When you don't have that, you are prone to having osteoporosis. When you don't have the hormone that protects you, you are prone to having osteoporosis. For men, testosterone, their biggest hormone, testosterone is their own bone protective hormone. When they're growing older, the testosterone does reduce a little. Yes, men think they don't have andropause. Some men do. All right. So they are not as, I'm a man forever. No, your hormones decrease as you age. Let me let you know that now. Your hormones also decrease as you age. And also some men going through prostate cancer. And one of the treatment of prostate cancer is androgen deprivation therapy, ADTs, medications that reduces testosterone so your prostate cancer doesn't have anything to feed on. If you're a man or if you have a man in your life going through androgen deprivation therapy, you need to make sure that their bones are strong. They need to be on medications to help their bones get stronger. And they need to go through tests to make sure their bones are strong. So men and women can have osteoporosis when they have lower sex hormone. Estrogen for women, testosterone for men. Estrogen for women, testosterone for men. If any of those lower, good chance you may develop. All right. Let me keep going. All right. Let me see if I have any questions. Okay. So, and there we go. Risk factors. All right. We talked about that. All right. Another risk factor is when you don't have enough calcium and vitamin D. Now, a lot of you live in Nigeria. A lot of people live in all the parts of the world that there's sun. And you think, the people erroneously think, I live where it's sunny, so definitely I have a lot of vitamin D. No, you don't. I live in Houston. It's always hot. It's 80 degrees right now. I am shutting in my house because I don't like the sun like that. It is too damn hot. So a lot of you will feel that way, like you rather stay in the shade and you will not get as much sun as you think you're getting. So which means you have low level of vitamin D. All right, which is why when you go for your preventive care, your doctors will check your levels, check your blood levels, and make sure you have enough vitamin D in your system. Another thing a lot of people are lacking is calcium. Most Nigerian foods, myself included, we don't eat enough calcium. We do not eat enough calcium. If you want to know what is high in calcium, please go back to the videos where we talked about calcium, we talk about vitamins and electrolytes. You will have your sources there. But at the top of my head, milk. You need milk, you need dairy products, things like that. Vitamin D and calcium deficiencies, all right, can lead towards that. Another thing that can risk you, that make you, there's this nail that keeps bothering me, all right, is if you're taking medications for acid reflux. If you take some of the medication preclude, they can cause low absorption of calcium in your bloodstream. All right. So if you're taking medications for gastric reflux, if you're taking transplant medications, if you're taking medications for seizures, and if you're taking medication for cancer, like I explained with men earlier. So all these can give you a higher risk of developing osteoporosis. So again, please make sure you're following up with your doctor. All right. You're following up with your doctor and you're getting treated. All right. Other people that have disease like kidney disease, they have rheumatoid arthritis, they have inflammatory bowel disease, they have celiac disease, they have cancer. All these things can give you a risk of osteoporosis. All right. Lifestyle choices. What you do that can increase your chance of osteoporosis. You smoke. You shouldn't be smoking. I've not seen one thing that smoking is good for. Please, if you smoke, try your best to quit. If you smoke, higher risk of osteoporosis. If you drink alcohol, excessive consumption of alcohol, osteoporosis. All right. If you live a sedentary lifestyle, you're not exercising, you're not working out, you're not lifting weights, you can be skinny. You still need to exercise. You can be skinny, but you still need to exercise. If you take anything away from here today, I apologize. If you take anything away from here today, you need exercise in your life. Now, I'm not asking you to start lifting 10,000 pounds. I ask you to walk, do mobility exercises. Women, lift weights. You are not going to be bulky if you lift weights. It is good for your bones. Keeps you stronger. All right. So those are the things you can do. All right. So what are the complications of osteoporosis? What happens when you have osteoporosis? Everything starts to break. Your bones break, your back break, your leg break, your hand break, your everything. Your bones will break. You will have fractures. All you have to see how I cough right now, like that I cough. You can break a bone. Yeah, from coughing. I know. Because your bones are so weak. Very, very important. All right. How do you prevent yourself from developing osteoporosis? Exercise, lift weights, exercise. Make sure your diet you have calcium and vitamin D in your diet. If you know you are not, which I know most Nigerians are not, you can supplement your calcium and vitamin D. For any adult over 50, you need about 1,200 milligrams of calcium. Anybody under 50, you need 1,000 milligrams of calcium. Take it however you want to take it. You need that at least daily to keep your bones strong. I have calcium at home. My calcium is in form of caramel because the pills are too big for me to swallow. I don't like them. So I chew them, chewable. In whatever form it comes in, take your calcium. The sources of calcium that we have, low fat dairy product, dark green leafy vegetable, efo shoko, efo bure, what else? Ugu leaves, oziza leaves, all these leaves. But one thing I want to say is you don't cook them for 10 hours. You cook them 5 minutes tops because you want the nutrients in them. You want to keep the nutrients in there. Sardine, Titus, calcium, omega-3, calcium. Sardines have calcium in them. You want to eat fish, canned salmon, canned sardines with the bones. Don't pick out the bones. With the bones. Eat the bones with them. All right. You want to do calcium fortified cereals, calcium fortified oranges, anything calcium fortified if you feel that you're not getting enough calcium. All right. Please make sure you're getting your calcium. All right. Vitamin D Vitamin D, you need at least 600 to 800 units. Like I just tell people to pick up over the counter vitamin D, 1000 units. Take that every day. You need that every day. All right. Sources of vitamin D includes fishy, oily fish, Titus, salmon, cod liver oil, trout, things like that. Make sure you're looking at your vitamin D. All right. And make sure if you don't eat any of those, supplement. You need at least minimum 1,000 daily. 1,000 milligrams daily supplement so your bones can be strong. People underestimate the power of bones until when you can't walk because you've broken your leg bone, or you can't carry things because you've broken your wrist bone. Things like that. So don't underestimate. All right. So we're making sure you're taking calcium. You're eating enough calcium or taking calcium supplements. Or you're outside getting some sun or getting some vitamin D. All right. Exercise, I talked about it. Continue to exercise. Please make sure you exercise. Now, how do we diagnose osteoporosis? It's called a DEXA scan. It's like an X-ray. It's painless. You go through it and it will see the amount of, how strong your bones are. It will let your doctors know. It's not something you can do by yourself. It's quite expensive. So you have to have a reason to do it. Even in the US, it's like only done for people over 50, except it's documented that you have low bones and stuff like that. You fracture it and all that. That's when your insurance pay for it. But if you have money, go for it. But it's called a DEXA scan. All right. Treatment. I won't talk about treatment here. There are treatments for osteoporosis, but that's between you and your doctors. But I will tell you this. When your doctor places you on that medication, once you take that medication, you cannot lay down for 30 minutes minimum. You take it on an empty stomach and you sit up or you move around, you do what you need to do. And you cannot eat for 30 minutes. You cannot lay down for 30 minutes. That's it. Just keep that at the back of your mind. All right. I will not talk about the treatment because I don't trust y'all. Now, let's look and see if we have any questions. If you have any questions that I can help you answer. Now, while I'm waiting for your questions, all right, can you tell me what is your favorite weight-bearing exercise? Is it jogging? Is it weightlifting? Is it resistance training? I do a combination of all three. On weekends, I walk. During the week, I do strength training and resistance training. I do a mixture of both. What do you guys do? What do you do? Hi, mommy. I see my mommy. Hi, mommy. I see my auntie. Hi, Auntie Weaver. I see my auntie here. So, yes. So what can you do to avoid blurry vision? We talked about that last video, sir. You have to go watch the last video. We talked about that last video. That last video. It was discussed in that video. Blurry vision was already discussed. We are keeping the topic to bone health and osteoporosis. Bone health and osteoporosis. All right. Now, while we're also waiting, what do you, after listening to this video, after you've paid attention to this video, what are you going to do different? Tell me, what are you going to do different? Because the purpose of me doing these videos is to enlighten you and hopefully make a change in your everyday lives. What are you going to do? This helps me feel good that I'm contributing into the world and I'm doing something better for the world. So you tell me, what are you doing? What do you plan on doing to ensure that you have good bone health? I want to see. I don't like walking, but I like lifting weight. Good. Lift your weight. That's it. Can you go for massaging if the pain persists at your back? You can go for massage, but you have to know what's causing the back pain. You have to find out, you have to go see your doctor and make sure it's not something that's broken. Because if it's something that's broken, you're going to cause yourself more pain. If your back pain is caused by muscular issues, then the massage can actually soothe your pain. But if your bone is broken, that's going to cause more pain. So you have to find out the cause of your back pain first before you commit to having a massage. Massage might make you feel better if it's not tough, but also please make sure you check with your doctor first. All right. So I'm waiting to see what one change are you going to make today to help your bone? Walk more, take supplements, and total lifestyle change. All right. That's a lot to do in one set. But if you want to do it, more grace to you. All right. More grace to you. Even before you miss Moji, even before they go for physiotherapy, they need to see a doctor. You need to see a doctor. Because not all bone pain can be taken care of by physiotherapy. They might need surgery. So which is why a doctor comes in. All right. Back to Miss Oyinkan. Work more, take supplements, and a total lifestyle change. I won't advise you to do everything at one time because you will get bored and drop it all. I want you to just make one change. One change is what I want to see. Give me one change. Do you want to start taking supplements? Do you want to start exercising? Or do you want to start taking supplements and exercising? Total lifestyle change is a lot to do in one sitting. So that's what I want you. I wanted to start to eat food that is rich in calcium. Give me an example, Miss Juliet. I don't like broad statements. I want one thing. I'm going to eat more fish. I'm going to take more vitamin supplement. I'm going to check my vitamin D level. What are you going to do? That's what I want to do. All right. That's what I want to know. Okay. I'm waiting. While I wait, I'm going to sip my hot water. Okay. All right. So it is 30 minutes into it. All right. We've been doing this for 30 minutes and I appreciate everybody. Can cod liver oil supplement help? Yeah. Vitamin D? Yeah, it can. Yeah. But for an adult, I would say just take the vitamin D supplement. But cod liver oil has vitamin D in it. Yeah, it can work. That can work also. If you like the taste, I don't like the taste. But if you like the taste, I don't like it. But yeah. So all I ask, please engage with this video. I see 11 people watching me right now. Thank you for joining me. Thank you for eat more fish and vegetable. Good, Mrs. Juliet. I like that. Thank you for joining me. Thank you for participating with me. Thank you for engaging with me. Thank you for showing me that I'm not doing this. This is not a waste of time. All I ask is please share this video, share with invite people to join our health talks. I'm here every Sunday, 6 p.m. Nigerian time, 11 p.m. Texas time, 12 noon New York time. I have a waist pain as a long and prayer work. I'm already applying balm. What else can I do? Sir, waist pain. You need to, the thing is, when something hurts, sir, first thing you want to do is find out what's causing it. What's causing it? Is it a bone fracture or is it a muscle pain? You cannot determine that without your doctor, sir. You need to go see your doctor. The self-medication is all you're going to do is just put a band-aid on the issue. You're not going to find a cure to the issue and you're going to continue being in pain. And I know if you're Muslim, you will have to be bending to pray and you're always going to be in pain. So the best option is please go see your doctor so they can find a cause and give you treatment for what's actually happening to you. Balm is just a balm. It's just to soothe it. It's not treating what's causing the pain. So please go see your doctor and get proper treatment so you don't have to be in pain in the first instance. All right. Good. So all I ask is please make sure you're sharing these videos with your loved one. Invite people to come watch me on Sundays. I'm here Sundays at 6 p.m. every Sunday. So I think that is it for this week. If we don't have any other questions, supplements habito. Okay. If we have no other questions, I will say goodbye. Thank you for joining me. It's been a pleasure. Thank you again for giving me the opportunity to talk to you and teach you guys everything I know. All I ask is please share this video, engage with this video, and invite your loved ones so we can be more than 10 the next video. All right. Thank you. It's been a pleasure. Dr. Sunshine signing off. And